Can COVID is an open science collective dedicated to rapidly mobilizing and sharing knowledge to help inform Canada's COVID-19 response. To learn more about us or how to join our community, you can visit our website at cancovid.ca.
And welcome to this week's edition of Can COVID Speaker Series. My name is Rosa Stalteri, and I lead the research and evaluations team here at Can COVID. And I have the great pleasure of introducing you to this week's speaker, Dr. Sonia Anand, who is the Canada Research Chair in Ethnic Diversity and Cardiovascular Disease, and also a professor at the Department of Medicine at McMaster University. And our title for today is Understanding COVID-19 Risk, Vaccine Confidence, and Immunogenicity in the South Asian Population in Canada. So before we get started, just want to note that we have saved some time at the end of today's presentation for a Q&A session. So please do enter your questions into the chats event. And we also have a brief announcement at the end that we will share. So without further ado, I will hand over the mic virtually to Dr. Anand. Thanks.
Thank you very much, Rosa, and thank you so much for the invitation to be here. And I'm happy to share an ongoing study that we are doing in the South Asian population in Canada. And this study is called CommUNITY, and it was funded by the COVID-19 Immunity Task Force through PHAT. So it's my pleasure to be here and share a little bit about what we have underway. So the rationale for us to take on a study in the South Asian population was really because South Asians are the largest non-white ethnic group in Canada. South Asian refers to people who originate from India, Pakistan, Bangladesh, Sri Lanka, essentially the Indian subcontinent. And early into the pandemic, studies mostly from the UK did demonstrate that South Asians living there had a 5 to 10-fold increase infection rate compared to non-South Asians, and also worse outcomes. And looking further in the vaccine trials, there were relatively low participation of South Asians in vaccine trials, less than 4% in the major trials. And when we scanned the COVID-19 studies in January of 2021 in Canada, we didn't identify any specific South Asian focused studies. And therefore, my research team, which is usually focused on cardiovascular disease, decided to try and address some of the outstanding questions in this community. And at the same time, we were continuing to read media reports of South Asian hotspots in the Greater Toronto Area and the Fraser Valley in BC. And there was some concern about misinformation in the South Asian community regarding testing as well as vaccination. So to address some of these gaps, we applied for the CITF funding in March of 2021. And just to highlight in the Greater Toronto Area, the number of South Asians living here, you can see it's close to 1 million, almost half of the South Asians in Canada. And you can see these familiar regions we read about week after week in the newspapers. The Peel region is home to 400,000 South Asians. Halton, Toronto, also very large proportion. So this is the target population of our study in the Ontario arm, and in British Columbia, the target area is the Fraser Valley, where there are also a large number of South Asians living. Early in the pandemic, when we were putting our application together, there wasn't very much data by ethnicity in terms of COVID-19 infection. So the Toronto Public Health group was able to put together some data. They don't always collect data on an individual level, but they could look at the population density of people living in Toronto and then look to see the proportion of individuals in these communities that were infected by COVID-19. And they showed that there was a disproportionately high infection rate in the South Asian population and some other ethnic populations you're probably aware of, such as the Black population and Southeast Asian population. And this is in comparison to the white population, where there's relatively lower COVID-19 infection. So again, the data aren't perfect, but certainly pointed towards this signal of South Asians being disproportionately infected with COVID-19. And when we look over time in Ontario, shown on the left, and in particular the Peel region on the right, we can see these waves of the COVID-19 pandemic that we're all used to seeing. In the top, I show seroprevalence estimates from that time. And although these studies are not perfect, we can see there are higher seroprevalence estimates at that time. And below, I show the vaccination rates in both of these regions. And you can see that they're almost identical in terms of the very high vaccination rate in Ontario overall and in the Peel region. So our study focused on 4 questions. We wanted to determine how robust the immune response was to vaccination, both before and after vaccination, as well as long-term. We wanted to look at the safety and effectiveness profile of the vaccination program in South Asians in Canada. We wanted to try and understand what were reasons South Asians may be hesitant to take a COVID vaccine. And also, we were very interested in understanding how South Asians receive and communicate health information regarding COVID-19. Our initial recruitment plan was to recruit South Asian participants from vaccine centers in the GTA and BC, as well as to capitalize on some of the large South Asian cohort studies we already have ongoing. So we've done a number of these in the past, and we've stayed in touch with our participants, and my colleague in British Columbia, Dr. Scott Lear, has done the same. And so this was the second form of recruitment into the studies. Then we plan to recruit into 3 groups. The group A is before and after vaccine assessment of antibody levels. Group B would be enrolling people after vaccination and a long-term assessment. And Group C was enrolling participants who were not vaccinated. So when we set out with this study in April of this year, this was the plan. Now, how has recruitment gone? Recruitment is ongoing, and we started in Ontario before we started in BC once we received the appropriate approvals. And we have had a great response from the South Asian community in vaccination centers. And this shows a group of our team members recruiting at the Brampton Soccer Center. And in total, from the GTA, we have recruited 1,235 so far. And we were overwhelmed by the interest of participants in learning more about COVID-19 and vaccine response in the South Asian community. And you can see in the picture here, we would approach participants who were waiting after their first dose of vaccine and enroll them into the study. So we continue to recruit from the Brampton Soccer Center. And we are grateful to Peel Public Health, who Dr. Lawrence Lowe is one of our collaborators who helped facilitate this. We were, as I mentioned, very excited that the South Asian community was keen on research. So they had not been approached or included in research studies to date in Canada, at least face-to-face recruitment, and there was a lot of interest in learning more. You can see our recruitment over time, the red line showing Ontario, the blue line showing British Columbia, which started later but is really picking up. And you can imagine it's quite a dynamic process as waves come and go, and as vaccines, initially the vaccine schedule was different in April as it is now. So as researchers in the field, we have to adapt to these changes. Now, from the immunogenicity perspective, as many other studies in this area are doing, we are collecting a dried blood spot, and we're going to measure the response to vaccination from the perspective of measuring antibodies. And these antibodies you'll be familiar with to spike protein, receptor binding domain, and nucleocapsid antigen. We use a dry blood spot kit where we, at the face-to-face clinics, we collect the blood sample right there. For the cohort participants, we mail them to participants at home. They self-complete and mail it back to our research institute. And then we ship these to the lab of Dr. Marc-André Langlois in Ottawa for the analyses. And you have probably all seen the different decisions for cutoffs and antibodies that we use to classify an individual having a natural COVID infection using the nucleocapsid and this anti-spike antibody. And for vaccine-related immunity, we look at cutoffs for the receptor binding domain and the spike antibody. Now, there are different immunity classifications. These are the ones that Dr. Langlois' lab is using. And it's interesting because in our discussions with them, we do talk about the background rates that they're comparing to from pre-pandemic levels of SARS infection. And this is from an Ottawa sample. So some of our discussions are, is this the appropriate background data to use when we're targeting a specific population from a different geography? Now, in terms of being able to answer the effectiveness and safety question in response to COVID-19 vaccines, our primary outcomes of interest for effectiveness are COVID-19 infection, hospitalizations, and death. And for safety are serious adverse events defined as hospitalization less than 14 days after vaccination. And with our original design, we plan to recruit 1,500 South Asians who are vaccinated and 1,500 South Asians who are not vaccinated. And after adjusting for the various differences between the two groups, we would have an assessment of the relative effectiveness and safety. The challenge we face has been not identifying enough South Asians who are not vaccinated. So despite intensive recruiting, we have less than 10 enrolled into that arm. Now it is ongoing, but it's been hard for us to find non-vaccinated South Asians interested in research, and maybe that's a good problem to have. But as a secondary approach to still get at that question, we're collaborating with Dr. Bajir Shah from ICES in Toronto, and we're just designing now a way to still ask and answer that question by using the unique surname identification of South Asians. At ICES, they can create some cohorts that we can use for comparisons of South Asian vaccinated, South Asian non-vaccinated, non-South Asian vaccinated, non-South Asian non-vaccinated, and through record linkage can essentially look at the event rates for the effectiveness and the safety outcomes of interest. So this is underway. With respect to vaccine confidence, this is a really important question. And before we started this work, there were some beliefs that perhaps a South Asian population where English is not always the first language would have vaccine hesitancy. And really looking at the data from the UK, one might suggest that some subpopulations within the South Asian community would be vaccine hesitant. So we built in an assessment in our study for vaccine confidence. We are using the VAX scale, which is a validated scale that measures 4 domains: mistrust of vaccine benefit, worry about unforeseen side effects, concerns about commercial profiteering, and a preference for natural immunity. And there are many other studies, some in Canada and others globally, using the same scale. So it's 4 domains, 12 items. They're scored on a Likert scale from 1 to 6, and it will give us some really interesting, informative information from the South Asian community with respect to some of these issues of vaccine confidence. And this is an example of the types of questions that we are administering now in our study. Now, to complement the quantitative assessment of vaccine confidence, we are also undertaking qualitative interviews where we are recruiting some of the vaccine hesitant South Asians that we've identified. We've invited them to participate in this component of the study, also healthcare providers for the South Asian community and advocates within the South Asian community who really pushed hard at the beginning of the pandemic to get testing facilities and vaccine facilities up and running in the South Asian hotspots. Now, the question of how is information being transmitted within the South Asian community is interesting. And we have tried to address it by having vaccine town halls where we invite the South Asian community to attend a Zoom town hall. We have experts on the panel discussing vaccination relevant to the South Asian community, and then we open it up for questions. And we can track the type of questions that people are asking as a way to understand what are the main concerns in the South Asian community. So we've done a first town hall where we focused on vaccine confidence, use of alternative therapy, questions at that time about vaccine mixing. We also had a second town hall, which focused on challenges to vaccination and community perspectives, and certain subgroups of the South Asian population who were slow to be vaccinated, such as international students. We also had a discussion about essential workers who couldn't take time off from work to get vaccinated. So these were very informative and very well attended. And from those town halls, plus a second approach, which is curating other social media, we can get a sense about the information transmission in the South Asian community. So my colleague Sujani Kandasamy is curating not only our webinar, but other types of media such as Twitter and Facebook posts that are commonly used in the South Asian community, as well as doing some Google Analytics to assess what are the main topics of interest in the South Asian community. We also, my colleague Sujani Kandasamy applied to PHAC and received an award to create a video that helps communicate the importance of vaccination to the community. And because WhatsApp is one of the most common ways that information is transmitted, this video then it was transmitted to large numbers of South Asians via WhatsApp. And I'll just show you like 30 seconds of it. Let's see if I can work this.
हम लोग साउथ एशियन हैं जो GTA और हैमिल्टन में रहते हैं। हम अपने साउथ एशियन बहन और भाइयों से रब्ता करना चाहते हैं। हमारा माता पिता माटे, हमारा मासियों अने काकाओ माटे, अने हमारा मित्रों माटे। हमारी
So that's an example, and that's available. It's a form of knowledge translation, science communication. And then I want to spend a moment just to speak to the advocacy that we've have come to understand was crucial in addressing some of the issues for the South Asian community in the pandemic. You'll see here some familiar faces from the news media. Lawrence Lowe, the medical officer of health in Peel, who's a co-investigator on our project. Raj Graywal, co-founder of the South Asian COVID Task Force. Sabina Vora-Miller from the South Asian Health Network. A number of well-known people across Canada, including the Minister of Public Affairs and Procurement, Anita Anand, who procured all the vaccines, Patrick Brown, the mayor of Brampton, and a number of other people. I would say that Crete here advocated for sick pay for essential workers in the Brampton area. And news media, so a number of journalists covered the South Asian hotspots on a regular basis in mainstream media to raise attention and hopefully help direct the provincial government's focus on these hotspots that was crucial at the time. So the ongoing challenges for the South Asian community is receiving clear information, and we're identifying what are the usual communication channels. Access to COVID-19 testing initially was difficult. It still is somewhat challenging for essential workers. Time off work if symptoms develop, both for testing and also time off work to get vaccination. Access to vaccines have largely been overcome through the advocacy work of many of the people I've shown you previously. And then now the next challenge will be access to medical care for COVID sequelae, and that will have to be addressed in the coming days. So just to summarize, our initiative, COVID Community, is just underway in April. We're still collecting data and analyzing our results. We focus on the largest non-white ethnic group in Canada. They're unique from the perspective of a greater proportion of South Asians in the Peel region, for example, are essential workers, live in multi-generational households, and send and receive health information in a different way. We were overwhelmed by the interest of the community in participating in this study, and we rely on the advocates for the South Asian community to continue to push for testing, vaccination, and information access. So I'll stop here. I'd like to credit a large number of people who work hard on this study each and every day, and I look forward to some questions. Thank you.
Thank you so much, Dr. Anand, for this amazing and interesting study, and looking forward to seeing the rest of the results in the future. Just to let everyone know, it's the Q&A period. We have about 8 minutes for questions. So we'll get started. The first one is, what are some other effective strategies for addressing vaccine hesitancy? Specifically, how can information be especially tailored to this group and other subgroups for uptake?
That's a great question. And I didn't show the whole video, but I think a really crucial strategy is translation of the information into multiple South Asian languages. So if you listened in on that short video clip, you would have heard 3 South Asian languages already, and there are many languages. So one of the strategies we're using in this study to be more representative of the South Asian population in the GTA is to collect information on mother tongue and preferred first language, so that we have some representation beyond one particular subgroup of South Asian in our study. And also when we develop KT tools, we can tailor them by language to the different communities. So I'd say an essential feature is making information available in South Asian languages. There are many, but even focusing on the top 5 would be a great contribution.
Thank you so much. The next question is, with the lack of unvaccinated participants, how do you know that any adverse reactions are not due to the vaccine?
Well, the lack of unvaccinated in our study, one challenge is maybe unvaccinated individuals are not interested in research at all. So they might exist out there, but they wouldn't enter a study like ours. We're starting to see that there's a pattern like that. But I think our solution to try and track safety outcomes related to vaccines is a good one. And the inclusion of a group of non-vaccinated should serve as a great comparator. So as I mentioned, there are lots of different side effects people can report after vaccination, but we've settled on a relatively hard outcome, which would be hospitalization due to one of those side effects. And so I think we'll be able to have a good comparison between vaccinated and unvaccinated on that outcome over time. We should we should have relatively reliable data.
Thanks. And the next one is, how will the results and findings from the COVID community South Asian study be used to inform vulnerable subpopulations on the importance of COVID-19 and vaccinations?
Yeah, I think that all of this information is going to be very helpful to build trust in science and research and trust in our public health approaches in Canada. And so one could ask, why do we need a South Asian specific study if we have large observational studies in Canada and reliable randomized trials demonstrating vaccine effectiveness? And that's a good question. But we often see that if the community members do not see their own community members participate in research, they're less likely to trust the findings. And I've often found that when we've worked in the South Asian community and First Nations community, when the data is generated from their own community, they're far more likely to trust it and believe in it. And so this is one of the key positive outcomes of this research, to go back to the community, show our overall findings, and we think that will build confidence in COVID-19 trust of vaccines and health messaging that has already come from public health authorities.
Thank you. And so the next one is more of a remark, but maybe you might be able to elaborate on this. The remark was, I was curious about the effectiveness of translation into South Asian languages and curious as to whether, on the flip side, you see the same level of misinformation and disinformation in South Asian languages, or whether you think the aspect is more restricted to English-speaking folks.
Yeah, that's interesting. I think we're still learning that, and we'll find that out in the course of the study. We take care when we translate our information that we translate it, and then we often will have somebody else back translate it to make sure that we've translated it in the way that the community will understand, because sometimes the words in English are not directly translatable. So we do the translation and back translation. The second part of the question is interesting in terms of, where is the misinformation or miscommunication coming from? And I think I don't have an answer for that yet, but hopefully we'll have an answer by the end of the study.
And we have another question here is, how did you recruit the 10 unvaccinated participants? Were they friends, relatives of people already in your research?
A great question. And so, our greatest success in recruitment has been through the vaccine centers. And so when we invite the vaccinated to participate and they're sitting down, doing their consent form, etc., our research coordinator will ask them, is everybody in your family vaccinated? Do you have anyone who's hesitant to get the vaccine? Oh, yes. Yes, would they be interested in chatting with one of our study team members? So that kind of casual conversation is one avenue. And the second one was, we have some South Asian family doctors who have referred participants to us. So they've helped us recruit from their offices, and we've asked them to identify vaccine hesitant patients, ask if we can give them a call and approach them that way.
That's great, thanks. And we just see here, interesting thank you from Tarjot Kaur. So we have about a minute left, Dr. Anand. I was just wondering if you would like to share any last minute things with our attendees before we end the session today? Anything that you may have not shared?
No, I think the group for attending, it's interesting sometimes people who are not familiar with the South Asian community are not familiar just how large the South Asian population is in Canada. Another component that kind of is of interest for us is looking at comorbidities in this population. As I mentioned, I focus a lot of my cardiovascular research in this population because South Asians are high risk of developing type 2 diabetes, metabolic syndrome, and heart disease. So we'll have that, the comorbidities carefully documented, and we will look to see in terms of both the immunogenicity in different subgroups across age, income, presence or absence of diabetes. So I think that will be informative. And we'll also be able to look within our ICES record link data for the influence of comorbidities on effectiveness and safety.
Sounds very interesting. Thank you. And we have actually just one extra question here. Really nice study. Do you know about family structure? Will you be able to investigate the impact of children in the house or school exposure on natural immunity?
That's an interesting question. Natural immunity is going to be interesting because, as I mentioned, we are able to look at natural infection based on the antibody profile. But again, it's not a representative sample because we are recruiting most of our people from a hotspot in the vaccination center. So we'll have to keep the caveats about that in mind. But we do ask a number of questions about multi-generational households, who lives there, how many children are there, and if the participants are essential workers or could take time off of their jobs. I don't know that we can directly trace if a household that becomes infected with COVID is due to a child from school bringing it back to the family, but I would say we have another application under review at CIHR where we're asking to piggyback a study of children of school age on top of our South Asian birth cohort in the Peel region, where we're following 1,000 South Asian children to age 10. So we might be able to get the data that way.
Thank you so much. So we are 2 minutes past 4:30, so I'm going to end the session here. Just want to say on behalf of the CanCOVID team, I'd like to extend our thanks to Dr. Anand for sharing with us an overview of COVID community South Asian and what you and your team has on the way. And of course, we'd like to say thanks to our today's attendees as well for joining. So just a few announcements. Next week's speaker series is on Tuesday from 4 to 4:30 Eastern Daylight Time, where you will hear from Dr. Maxwell Smith, who is an assistant professor of bioethics and health policy at Western University. And the topic of the presentation is bioethics and COVID-19. And details about all of our events are on our website and will be included in this week's newsletter. Be sure to subscribe to our weekly newsletters if you haven't already done so you can stay up to date on our events and other initiatives.
We would like to thank our speakers and members of our network for their continued support and participation in Canada's pandemic response. If you are interested in learning more about CanCOVID or joining our Pan-Canadian COVID-19 Research Network, please visit our website at www.cancovid.ca.